Welcome to Healthy Habits. We are so glad you found us. Here at Healthy Habits, we are dedicated to helping you live your healthiest and happiest life. Our channel is all about sharing practical tips and advice for improving your nutrition, staying active, and maintaining a healthy lifestyle. Whether you're looking to lose weight, boost your energy levels, or just feel better overall, we've got you covered. Our team of experts will provide you with the latest research and recommendations for living a healthier life. So join us on this journey to better health and wellness. Subscribe to our channel and hit the notification bell to stay updated on all of our latest videos. We can't wait to share our healthy habits with you.
Food to avoid if you have arthritis. Arthritis is a chronic inflammatory condition that affects the joints and often results in pain, stiffness, and swelling. There are more than 100 different types of arthritis, each with its own unique symptoms and causes. The most common types of arthritis are osteoarthritis, rheumatoid arthritis, and psoriatic arthritis. Osteoarthritis is a degenerative joint disease that occurs when the cartilage, which provides cushioning between the bones, breaks down over time. This leads to bones rubbing against each other, causing pain and stiffness. Risk factors for osteoarthritis include age, obesity, injury, and genetics. Rheumatoid arthritis is an autoimmune disease in which the immune system attacks the synovial membrane, which lines the joints. This causes inflammation, pain, and stiffness, and can eventually lead to joint damage and deformity. Women are more likely to develop rheumatoid arthritis than men, and it typically starts between the ages of 30 and 50. Psoriatic arthritis is a type of arthritis that occurs in people with psoriasis, a skin condition characterized by red, scaly patches. It causes joint pain, stiffness, and swelling, as well as skin and nail changes. There is no cure for arthritis, but there are treatments that can help manage symptoms and slow the progression of the disease. These may include medications, such as non-steroidal anti-inflammatory drugs, NSAIDs, and disease-modifying anti-rheumatic drugs, DMARDs, as well as physical therapy, exercise, and lifestyle modifications, such as maintaining a healthy weight. Arthritis is the most common cause of disability in the United States. Believe it or not, nearly half of all adults will have arthritis by age 65. It's important to eat a balanced diet that includes plenty of fruits and vegetables along with other foods known to reduce inflammation such as whole grains, nut seeds, and fatty fish like salmon. However, there are many foods that you must avoid to prevent the inflammation of the joints from getting worse. In this video, we are going to be talking about foods you need to cut off if you suffer from this condition. Please note this video is for educational purposes. If you have any medical concerns, please do speak to your doctor. That said, let's jump in and talk about the foods to avoid if you have arthritis. Gluten. Gluten is a protein found in wheat, barley, and rye, and some people may be sensitive to it without realizing it. In individuals with gluten sensitivity, consuming gluten can trigger an immune response that leads to inflammation throughout the body. This inflammation can exacerbate the symptoms of arthritis, making it more difficult to manage. By avoiding gluten, individuals with arthritis may be able to reduce the severity of their symptoms and improve their overall quality of life. Additionally, gluten sensitivity is often associated with other autoimmune disorders, and avoiding gluten may help to manage these conditions as well. Red meat and processed meat. One reason for this is that red meat and processed meats are high in saturated fats, which have been linked to increased inflammation. These fats can also contribute to the development of heart disease, which is a common comorbidity for individuals with arthritis. Additionally, red meat contains a compound called purine, which is broken down into uric acid in the body. High levels of uric acid have been linked to gout, a type of arthritis characterized by intense pain and swelling in the joints. In addition to the potential inflammatory effects of red and processed meats, these foods may also contribute to weight gain, which can put added strain on the joints. Being overweight or obese is a known risk factor for arthritis, and losing weight through a healthy diet and exercise routine can help to reduce the severity of symptoms. Added sugars. First, consuming sugar can contribute to inflammation in the body. When you eat sugar, it triggers the release of inflammatory molecules called cytokines. Over time, these cytokines can lead to chronic inflammation, which can exacerbate the symptoms of arthritis. Additionally, sugar can contribute to weight gain and obesity, which are both risk factors for arthritis. Being overweight puts added pressure on the joints, which can lead to increased pain and inflammation. By reducing your sugar intake and maintaining a healthy weight, you may be able to reduce the severity of your arthritis symptoms. Finally, sugar can also contribute to the development of other health conditions that can make arthritis worse. For example, consuming too much sugar can lead to the development of type 2 diabetes, which is associated with chronic inflammation and can increase the risk of developing osteoarthritis. Sugar can also increase the risk of heart disease, another common comorbidity for individuals with arthritis. Alcohol. Firstly, alcohol can interfere with medications commonly used to treat arthritis, such as NSAIDs and disease-modifying anti-rheumatic drugs (DMARDs), making them less effective or increasing the risk of side effects. For example, alcohol can increase the risk of stomach bleeding and liver damage associated with NSAIDs, as well as increase the risk of infection associated with DMARDs. Secondly, alcohol consumption can lead to weight gain and dehydration, which can exacerbate joint pain and inflammation in individuals with arthritis. Excessive alcohol consumption can also increase the risk of developing gout, another type of arthritis that is caused by a buildup of uric acid crystals in the joints. Moreover, alcohol can have a negative impact on bone health. Heavy drinking can reduce bone density and increase the risk of fractures, which can be especially problematic for individuals with arthritis who already have weakened bones due to the condition itself. Highly processed foods. One of the main reasons to avoid highly processed foods is their high content of refined carbohydrates and added sugars. These types of carbohydrates are quickly absorbed into the bloodstream, leading to a rapid rise in blood sugar levels. This spike in blood sugar can trigger an inflammatory response in the body, which can exacerbate arthritis symptoms. Moreover, refined carbohydrates are often low in fiber and nutrients, which can lead to weight gain, a known risk factor for arthritis. Additionally, highly processed foods are often high in unhealthy fats, such as trans fats and saturated fats, which can increase inflammation in the body. These fats can also contribute to weight gain, which can put added stress on the joints and exacerbate arthritis symptoms. Furthermore, highly processed foods are often high in salt, which can contribute to fluid retention and swelling in the joints. Foods high in salt. One of the main reasons to avoid foods high in salt is their potential to contribute to fluid retention and swelling in the joints. Arthritis is a condition that causes inflammation in the joints, leading to pain, stiffness, and reduced mobility. Consuming foods high in salt can exacerbate these symptoms by increasing fluid retention in the joints, leading to further inflammation and pain. Moreover, foods high in salt can also contribute to high blood pressure, a known risk factor for heart disease and stroke. Individuals with arthritis already have an increased risk for heart disease and stroke, so consuming too much salt can further increase this risk. Additionally, many foods that are high in salt are also highly processed and low in nutrients, such as fast food, processed meats, and canned soups. These types of foods are often high in unhealthy fats, refined carbohydrates, and added sugars, which can also contribute to inflammation and weight gain, a known risk factor for arthritis. Certain vegetable oils. One of the main reasons to avoid certain vegetable oils is their high content of omega-6 fatty acids, particularly linoleic acid. While omega-6 fatty acids are essential nutrients that our bodies need, consuming too much of them can lead to an imbalance with omega-3 fatty acids, which can increase inflammation in the body. Inflammation is a key driver of arthritis and can exacerbate symptoms such as pain, stiffness, and reduced mobility. Moreover, certain vegetable oils such as corn oil, sunflower oil, and safflower oil are also high in pro-inflammatory compounds called cytokines. These compounds can further contribute to inflammation in the body, worsening arthritis symptoms. Additionally, certain vegetable oils such as canola oil and soybean oil are often highly processed and may contain harmful chemicals and additives that can also contribute to inflammation in the body. Instead, it is recommended to focus on incorporating healthy fats into your diet, such as omega-3 fatty acids found in fatty fish, walnuts, and flax seeds. These types of healthy fats have been shown to have anti-inflammatory effects and may help reduce arthritis symptoms. Dairy. One of the main reasons to avoid dairy products is their high content of saturated fats. Saturated fats are known to increase inflammation in the body, which can worsen arthritis symptoms such as joint pain, stiffness, and reduced mobility. Moreover, saturated fats can also contribute to other health problems, such as heart disease and high cholesterol levels. In addition to the high content of saturated fats, dairy products also contain proteins, such as casein and whey, which can potentially trigger an immune response in some individuals. This immune response can lead to inflammation in the body, further exacerbating arthritis symptoms. Furthermore, some people with arthritis may also have lactose intolerance, which can cause digestive problems such as bloating, gas, and diarrhea when consuming dairy products. These digestive symptoms can also worsen arthritis symptoms and decrease overall quality of life. Instead of dairy products, it is recommended to incorporate alternative sources of calcium and vitamin D, such as leafy green vegetables, fortified plant-based milks, and supplements. If you have arthritis, eating a slightly healthier diet can actually help reduce inflammation. Here are some tips for making better food choices. Cook with olive oil instead of butter or margarine. Butter and margarine contain trans fats that can increase inflammation in people with arthritis. Olive oil contains heart-healthy monounsaturated fats that help reduce inflammation in joints and lubricate them so they move more easily without pain or stiffness. Choose fish high in omega-3 fatty acids, like salmon, tuna, or mackerel at least twice a week for their anti-inflammatory properties. Omega-3s have also been shown to help relieve joint pain in people who don't have rheumatoid arthritis. Using a steamer instead of boiling vegetables. Boiling water adds heat to your home and increases stress on your joints. Steaming vegetables keep heat out of your home, making it easier for you to cook without straining your joints too much. You can also use a pressure cooker for many foods like beans or rice. Make sure you're getting enough vitamin D from foods like milk or fortified foods such as orange juice or cereal bars. If you don't get enough vitamin D from these sources, talk with your doctor about taking supplements.
Thank you for watching this video on healthy habits. We hope you found the information helpful and are motivated to make positive changes in your own health and wellness journey. Don't forget to subscribe to our channel and hit the notification bell to stay up to date on all of our latest videos. We post new content every week, so there's always something new and exciting to learn. If you have any questions or comments, feel free to leave them in the comments section below. We love hearing from our viewers and always do our best to respond to your comments. Thanks again for watching, and we'll see you in the next video.